There, I'll be pausing it between. How to pause in this? Pause in this? I don't know. So I'm removing the coronal GP and all the caries. This is a high rem kit which I've used. It has three types of drills. I've used a drill which is red color, that is around 1.2 for a premolar. Working length was around 19 mm. So I've used it around 11 mm. I usually, after that, use the drill with a slow speed. You need to, with a slow speed, you are going to remove the GP. Then, after removing the GP, you can, if I have the option of pausing it, I can quickly explain. Paracore or Parabond, which has three. How many of you used Paracore kit? Paracore kit. Yeah. So it has three bottles: green, yellow, and red. Green is what? Conditioner. Yellow is yellow and red. Red is a bonding agent. Conditioner and your yellow is a primer. Okay. So you are going to mix primer and the bonding agent, and the conditioner is always separate. So when you are using this, has almost all the kits have the similar kind of composition. So once you do that, I'll go into detail of that bonding in a while. Let me finish this. So then you build up the core. Once you build up the core, then build up a little bit extra itself, so that when you're preparing, you get a good finish line, and cure it. Okay, this is a dual cure. This is a dual cure cement, where the part inside the canal gets cured by chemical reaction, and when you light cure it on top, it initiates the reaction and causes the setting. Okay, it is always advisable to use a light cure. Okay. So don't think that it is going to be a chemical cure. It takes around 8 minutes to set to the chemical reaction. So till then you cannot wait. So use a light cure on top. That also initiates polymerization. Okay. Now bonding to radicular dentine, I'll quickly go through this. Bonding to the coronal dentine is very easy because you have access, because dentine is here, dentine is flat, and you can actually see there is an option there where you can actually convenience is there, whereas bonding to root is extremely difficult. Root dentine is different than your coronal dentine, and root has many, the root canal has undergone lot of changes throughout the procedure. So what are the differences in the characteristics? So the first one is, there are because of the endodontic treatment itself, the root dentine has gone through a lot of changes. You have used hypochlorite, you have used calcium hydroxide, you have used EDTA. So, and you used a lot of intracanal medicaments. There is a sealer, there is a you have zinc oxide eugenol sealer which gets impregnated into the dentinal tubules. There is a study which shows that around 300 microns it gets into the tubules. Okay, so it is extremely difficult. So keeping the end in mind, when you are starting itself, please do not use zinc oxide eugenol based sealer. That is your normal ZOE sealer if you are going to do a fiber post. Okay, keeping the end in mind. How many of you are using ZOE sealer still? 1, 2, 3. Please stop using ZOE sealer. It's outdated, obsolete. You cannot use. Gets disintegrated, causes a lot of failures. If you are using a fiber post, you cannot use fiber post if you are using a zinc oxide eugenol based sealer. Okay, but there are some studies which say you can remove the dentine which is there covering the root to remove the sealer, but it is not possible. It will hamper the polymerization reaction. It will hamper the setting of the dual cure cement. So zinc oxide eugenol, preferably all cases use a resin based sealer. Now resin based sealers are not like old and like 5 years back where UH plus was so expensive you couldn't afford. Now it's relaxed. we can use a resin based sealer. Charge the patient a little bit more so that you can cover it. Okay, but please do not use zinc oxide eugenol based sealers. Okay, even calcium hydroxide based sealers also okay to a certain extent, but not ZOE sealer. Okay, Seal Apex, it doesn't cost much. You can use. Then it has there are possible effects of the endodontic treatment we completed. Root canal, it has high polymerization stress. Okay, we have then accessibility. Like I said, you cannot actually etching the root canal root dentine itself is very difficult. Okay, I have an experiment which we did. Structurally, the root dentine has fewer dentinal tubules than the coronal dentine. Root apical region, the tubular, it's more tubular. Because of the sclerotic dentine formation in the apical region, the radicular dentine in the apical region is very dense. So the bonding becomes difficult for root dentine. So, and our favorite polymerization shrinkage, which you cannot control it. All the resins undergo 2 to 5% of shrinkage when you cure it. And there is something called C factor, which is the ratio of bonded to the bonded surfaces, bonded to the unbonded surfaces. C factor. Okay. How many of you are aware of C factor? Configuration factor. Okay. See, C factor is something where we don't know if the C factor is high. Like for example, if it is a class 1 cavity, okay, I'll take 5 minutes more extra. Okay, the C factor is, if it is a class 1 cavity, your C factor is around 5. Okay, you have 5 by 0 or 5 by 1. Okay, you have only one unbonded surface and you have 5 bonded surface. You're able to imagine, no? You have a class 1 cavity. It's a box shape, isn't it? You have 5 bonded surfaces, buccal, mesial, distal, lingual, pulpal, and you have only one unbonded surface. So the C factor is 5. 5 by 1 is 5. So in a cavity, class 1 cavity, this is the highest C factor which you can get. Class 2, it has the C factor is 2. Class 3, C factor is 3. Okay. So like that, if you calculate the C factor, so it all the more why C factor is important? Shrinkage, polymerization shrinkage is high in cases where C factor is more. Okay, and this polymerization shrinkage stress, which is 2 to 5%, when the composite or the resin shrinks after it gets cured, it shrinks. When it shrinks, there is a possibility that it can overcome the bond strength. Okay. You are able to understand now? It can overcome the bond strength. See, the composite is bonded to the tooth here. So when it shrinks, the composite shrinks in the center. Okay. So when it shrinks, it pulls because of the shrinkage stress, it pulls the composite. So this shrinkage stress will overcome the bond strength. What is the bond strength? Maximum we will get a bond strength of 30 megapascal. Okay, 20 to 30. If it is a 4th generation, it is around 20, 24. If it is 5th generation, it is around 30. Okay. So there is a chance that it can cause that there is debonding, or if not debonding, there will be cuspal flexure. Okay. Because of this strength, there is going to be cuspal flexure. Okay. So because of that, you can see some crack lines on the cusp. So in a high C factor, so that's why when you are doing, if someday we organize a CDE program on composites, I would like to tell you how to reduce the C factor. So if you are going to place composite in class 1 cavity where composite is touching all the surfaces, that is pulpal, all the 5 surfaces, then that is a disaster. So if you are going to place composite on 2 surfaces, you are reducing in a cavity of high C factor, you are reducing the C factor to 2. If your composite is touching only 2 walls. Is it clear? So that's how important C factor is. Alright. Now coming to the radicular dentine, the C factor is 200. When you compare with the cavities, and the radicular dentine, your C factor is 200. So extremely high C factor will cause debonding. When you bond the post, when there is curing occurring, there is so much of stress in certain areas of the post. There is no bonding at all. See, as we know, when we prepare canal, you can say around, when we instrument the canal, we are only touching around 40% of the canal. The rest 60% is left untouched, no matter what instrument you use, isn't it? So if you use any rotary instrument, that's why that's why your hypochlorite is so important. Where the instrument is not touched, your hypochlorite is reaching those areas and disinfecting. Similarly, there are so many areas in the fiber post where it is not bonded. So because of that, it leads to leakage, and that's why there is very common dislodgement of the fiber post. So you need to keep this factor in mind. Apart from that, there is moisture. You cannot dry the canal so well. There is moisture, there is sealer. All these factors will hamper the bonding. All right. So the canal preparation, when we do, all these effects will play a major role. All right. So how to select a bonding agent? So there is the three main types of bonding agent, and with an excellent track record, you have 3-step self etch and rinse technique. Your 4th generation, where you are going to etch, where you are going to apply a primer, and then this is only for root. Okay, this is for the root, not for the cavity. Don't apply to the cavity. Okay. Then there are self-etch cements and self-adhesive cements. Okay. So the best one is this. Okay. You are going to etch it, but it has to be dual cure. Your bonding agent and your cement has to be dual cure. You cannot use you can use a self cure, but not a light cure, because your light is not going to, the depth of light cure is going to be only 2 millimeters. So the inside part is going to be always uncured. All right. This is a small experiment where this is a placement of an etchant. How there is an air bubble here. When you place an etchant with a normal cannula, how inadequately it etches the canal. So once you inadequately and apart from that, when you use a 3-way syringe here, the etchant is not being removed completely. You can see here some amount of etchant is illustrates that the etchant which is used to etch the canal is not removing you are not being able to remove. So what will happen if there is etchant still in the canal? You are not able to apply a primer or a bonding agent. It will completely hamper the bonding. So if you see the picture, you will understand. So a very simple modification in your technique you need to do. The normal cannula which you use for etching should not be used. You need to use a syringe for etching, which goes all the way till the apical portion of the post space. So from there you are going to slowly inject up and come, so that there is uniform placement of etchant. So once there is uniform placement of etchant, you leave it for 20 seconds, and then when you are rinsing it, the same cannula is taken out, or similar cannula can be taken out and placed in a 5 ml syringe with water. So the syringe is inserted till the apical portion and injected. All the etchant is going to come out. So it clearly depicts that see, this is how they have changed the cannula and placed the etchant, the uniform placement of the etchant, and clearly irrigate. Once you irrigate, the whole etchant is going to come out. Okay. Another mistake what everybody does, we use this. Okay. Actually, the manufacturer provides you this. He gives you, but you need to use it. So this will actually hold the will apply the primer and the bonding agent throughout the surface, whereas this will not apply. Okay. Common types of failures, 2 more slides. The most common type of failure where we discussed is the loss of retention and root fracture. Okay. Other types of failures are so many. Abscess can happen, caries, bend fractures, technical loss of retention, root perforations. All this can happen, but the most common are these. Okay. How to remove a post? For metal post, ultrasonics is the name. Okay. Do not use high speed, use ultrasonic, be patient, slightly trough around the post, remove the cement, and then slowly try to loosen the post. Okay. Remove the, don't remove too much of two structure, slightly shake the post and the post will come out. Whereas in case of fiber post, there are multiple kits that are available. You don't need to invest on a kit. I'll tell you what you need to do. You need to have 2 burrs, okay, with slow speed, and a round burr with high speed. Then use once you have this, you need to first remove the core and see where the post is. In the center of the fiber post, place the drill and make a small hole. Okay. After that, you start with your piezos. Go with the piezo till wherever it goes, go and remove it. So what it does usually is the fiber post is breaking. So it is easy to remove it. You don't. There are so many types of drills or the systems which are available to remove the kit, but you can do away with this. Right. To conclude, I would say select your post based on the indication which you are being told, and special care should be given for bonding to the radicular dentine, and use and all the teeth of the posterior teeth has to be crowned, whereas the anterior teeth don't do over treatment. Anterior teeth where there is no aesthetic requirement, if there is only core filling which is required with the composite resin, will do the job. Thank you. Thank you, Dr. Shiraz. I take this opportunity to thank Dr. Gausia, One Dental Solution, for giving me this opportunity to be in front of you, and our well-wishers and friends, Dr. Pasha sir and Nadeem, acknowledging my good friend and well-wisher, Dr. Iftikhar, and my co-examiner for all the exams. Hope we keep conducting exams this way. Thank you all.
Thank you, Dr. Shiraz. A brilliant presentation of posts. The only thing, the C factor has become an X factor to most of us. So it's slightly bouncing. I would like to call Dr. Iftikhar, a senior endodontist, professor in Al-Amin Dental College, to facilitate Dr. Shiraz with a bouquet. Thank you, Dr. Iftikhar. I think I'll take the liberty to give the memento to Dr. Shiraz. I'm Dr. Nadeem. Yeah, getting on to the further presentations about the launch of the surgical retractor, I would like to call Mr. Prasad on stage and take the proceedings further. Mr. Prasad.
Thank you. Good afternoon to all of you. I'm sure all of you are hungry. We will not take too much of your time. As One Dental Station, we created to give a platform to a dentist, and hence the idea was conceptualized a few years ago with a vision of getting the best quality of dental equipments and products at economic prices exclusively under one roof. Our mission is to bring down the cost of everyday consumption materials for our dentists. So in the process, we always keep going around the world, sourcing out for different products, and that's when we came across our fraternity dentist, Dr. Nair, who had a wonderful invention of Dr. Nair's Z-Tractor. What we understand, how this instrument is going to be a game changer in the treatments, is something which we will get to see forward. And this excited us when we got to know about his invention. What better than partnering an Indian dentist out of everyone is all that excited us to come here, create this platform, and be a part of his launch. Hence, on this special occasion, we were wondering who can be the best person to be called for launching this product. We went by the comment saying, home is the first school, parents are your first teachers. So none other than Mr. and Mrs. Subban, Dr. Nair's parents, we thought are the ideal people to come and help us with this launch and give their blessings to Dr. Nair as well as the product and each one of us who are sitting here. Can I request Dr. Nair's parents here, please? We really find it is very, very difficult at this age for them to come up here, but we felt what blessings a son can get from his parents is the